January is Cervical Health Awareness Month, a time to raise attention to the fact that the disease can be prevented. Joining us with some of the details is Vice President of Care Management with Priority Health, Ann Donnelly. Ann, good to see you. Thanks for being here.
Well, thanks for having me. Good morning.
Well, let's first talk about cervical cancer. Can you, let folks know exactly what that is if they don't know?
Absolutely. Cervical cancer is actually some abnormal cells that grow within the cervix, which is in the bottom narrowing of the uterus.
Okay. And I know that there's some tests that can be done that can actually prevent cervical cancer and find it early. Is that correct?
That is correct. And it is so important that we do those tests regularly as women. 12,000 females are diagnosed with cancer every year. 4,000 women die every year from the diagnosis, which is a staggering percentage. But early screening and detection can have one of the best outcomes of this disorder. It's one of the most easily curable gynecological cancers there are. 2 tests, a Pap test and an HPV test, is all it takes to do an early screening.
And is there a certain age where you could start getting those tests?
It's recommended that women start being tested at age 21 through age 29. At 30 through 65, you still need to be tested, but you need to have an individualized care plan with your provider to determine the frequency and types of tests after age 30.
If someone does end up having cervical cancer, what's used to treat it?
Depending on the time and the staging, it's really an individualized care plan. If it's caught early or even precancerous, you would probably go in and have what's called a colposcopy, where they scrape the abnormal cells right out of the cervix and then do regular monitoring. The more advanced the cancer, the more invasive and types of treatments that have to go on. And it really is dependent on the recommendations of your oncologist, potentially your surgeon, and your primary care physician.
Can you tell us more about HPV and maybe who should get the HPV vaccine?
Absolutely. So HPV is that stands for human papillomavirus. It's really the most common cause of cervical cancer, not the only, but the most frequent. And it can actually be prevented by a vaccine. Vaccines should be given to males and females, ideally in their preteen years. So that would be 11 or 12 years old. However, you can have it as young as 9 and up to age 26.
Very good. And if people want more information, where should they go?
Oh, there's all sorts of resources. If you're a Priority Health member, you can reach out to our Cafe Well on our website, and it'll walk you through that. And the CDC is always a wealth of information for any kind of preventative health services.